Forum on Long-Term Care Financing, held at the McNamara Alumni Center at the University of Minnesota. Session title, Long-Term Services and Supports Trust Act, presented by Catherine Kinnaman, filmed on January 7th, 2020.
My name is Kathy Kinnaman. I'm the Deputy Director for our Home and Community Services Office, which is part of the Department of Social and Health Services in Washington State. And like my bio said, I have been involved in healthcare for probably 26 years on and off. I've worked in the local DSHS offices, delivering various benefits. I've worked for our healthcare authority, which is our main Medicaid agency, and then I came over to the Home and Community Services Office in 2013. So that said, I will jump in. Thank you, Minnesota, for inviting us. So I'm sure some of these numbers are going to be familiar just from Professor Cohen's presentation, but this kind of looks at across the whole nationwide what's driving some of the state innovation. And I'm sure Minnesota and other states are all facing the same issue. There is this national trend in the aging population that the 65 and over population is going to more than double, and the 85 and older population will more than triple by 2015. And while that's wonderful that we're all living longer, how are we going to pay for those long-term care services that we know we will eventually need? So what's driving the state innovation for us is that increased demand for services. Most of us are going to need long-term services and supports. We know that about 7 in 10 individuals over the age of 65 will need those services and supports. But we still face challenges, and like Professor Cohen indicated, we know we have to spend down to Medicaid. For Washington, there's a $2,000 limit to be able to qualify for Medicaid-funded long-term care. We also know that Medicare doesn't cover most long-term services and supports. We'll cover nursing facility care, but it does not cover community-based care. We also know that we're going to need to support families in caring for their loved ones. We have 40 million caregivers nationwide, providing $470 billion annually in unpaid care. And care ranges from bathing, dressing, paying bills, transportation. I'm sure many of you are very personally familiar with the toll and the impacts of caregiving for a loved person. There's also other impacts. For the person that's providing care, there's that loss of earning potential. There's decreased savings for retirement. There's impacts on their ability to care for their own children's needs. And there's increased healthcare costs due to the stress and burden that they experience in the caregiving role. We know it's good public policy to support these unpaid family caregivers because not doing so impacts their health and well-being. And it also would have an immediate impact on our Medicaid spending. So this slide just looks at the pathway to Medicaid, the economic and health impacts. It's really not if, it's when we will need to turn for long-term care or need to turn to Medicaid. And our families are overburdened with providing care. In Washington, the long-term care insurance market is failing. Most of our insurers have pulled out of the market. Of the few that are remaining, I was talking with the Insurance Commissioner's office just recently, and they believe that there's another 3 companies that may be pulling out of the market within the next 3 to 5 years due to insolvency issues. We know we can't rely on long-term care insurance. More than 90% of Americans are uninsured for long-term care. Medicare doesn't cover it, and our personal savings levels are not enough. Our average senior retirement savings, $148,000 if you're lucky. The average life cost of long-term services and supports, over $260,000. Clearly, there's something here that does not add up. And we're familiar with how states pay for Medicaid. And you can see that, for long-term care. Medicaid is the payer in over 50% of the costs of spending in this arena. There's about 21% that have other public benefits available. We have private insurance, which is at 8%, probably less as the premiums become more and more costly and out of the reach for most Americans. And then around 20% of folks will have to pay for long-term care services out of pocket. So what I'm really here to talk to you about is the approach that Washington took and the passage of our Long-Term Services and Supports Trust Act that passed in January of last year. You've probably seen news articles about this, maybe. We've been going out all over to many, many states talking about the approach that Washington's taken. There's lots of interest. I'm sure that's why Minnesota invited us here today. And we are the first state with a public long-term care program. This particular slide is really mirrors the first one that I showed you, which was the national statistics. This one is Washington specific, and it's the projected growth of older populations in Washington as a percentage of the 2012 population. And I think that, as you can see, the largest growth rate is the population age 85 and older. And so how are we going to continue to afford to pay for care? That's something our legislature has been thinking long and hard about. We had a long-term care commission that was looking into this for probably the last 5 years, I would think. They've been convening lots of forums on how to do long-term care financing, very similar to what you're doing here in Minnesota today, with lots of presentations. I remember actually going up there and presenting on the long-term care partnership policies in Washington when they went into effect. So it's been quite a while that we've been looking at this issue and struggling with what to do, knowing that the budget is unsustainable for us moving forward. So in January 2019, the legislature passed House Bill 1087 and Senate Bill 5331 with bipartisan sponsorship and support, and our Governor Jay Inslee signed the bill into law on May 13th, 2019. It established a Long-Term Services and Supports Trust to help individuals pay for their long-term care. Many of our stakeholders and partners were vocal in their support for the bill. So what the law does is it really builds on Washington's strengths. Some of the factors that we have in place in Washington is we have a high-performing LTSS system by AARP. We're 34th in the nation for long-term care costs to the state, which is quite conservative. Over 86% of Medicaid recipients receive services in their own homes or local community residential settings. So Washington really is a rebalanced state with around 10 to 12% of folks receiving care in nursing facilities. So we were looking at what do you do next when you are a rebalanced state? What's the next step to go? We also have a professionalized long-term care workforce. They have a state union that represents them, and they have pay and benefits, retirement benefits, and the whole 9 yards for our workforce. We just implemented in January of this year, it just went into effect this last week, a paid family medical leave act, and I have staff who are taking advantage of it already, so that's awesome. And then we have a fully integrated payment system. So our Provider One system handles both medical claims and social services claims in the single system. So how is it going to work? Well, I'll get into more details, but bottom line is the Washington workers are going to pay up to 58 cents per $100 of their income into the trust. Every W-2 worker contributes, so if you're an employee, you will contribute and those payments will start coming out of your wages. The employers do not contribute in Washington. If you're self-employed, you can opt into the trust to get benefits. And if you have long-term care insurance, you can opt out of the trust. So we do have some opt-in, opt-out features. I'm not going to say they're the best solution, and I think that's probably something the legislature is going to come back and take a look at in the next session. There will be a trust commission that will pull together, and they will determine the rate of pay. I will say the bill is silent on our tribes. We have 29 federally recognized tribes in Washington. At this point, the bill does not talk about how this will impact the tribes, so we will be having more conversations around that. So what does the benefit do? In the first year, each person who's eligible to receive the benefit can access services costing up to $36,500. And the value of this benefit is indexed to inflation and so will increase over time. The benefit was actually based on $100 a day for 365 days. That's where that figure came from. It can be used for a range of services and supports, including professional care in your own home, licensed residential facility or nursing home, adaptive equipment and technology like wheelchair ramps, medication reminder devices, home safety evaluations, training, pay, and support for family members who provide care, home-delivered meals, rides to the doctor, et cetera, et cetera. And one of the things that we've been really looking at is it has to be really important that this is an insurance benefit and not a Medicaid or welfare type benefit. And so as we're thinking and we're having conversations about how do you implement this, one of the key things we're bearing in mind is that this benefit has to be flexible. I would like to see it like you can go buy things on Amazon if you want to. You don't have to go through, you don't have to go through a Medicaid certified provider to be able to get benefits. So, I don't know that it's going to be the cash benefit that Professor Cohen would prefer, but I would hope that it would be a very flexible benefit that would help families be able to choose which services they receive and when they receive those services. So how do you become eligible for the benefits that are available under the trust? And so to receive those benefits, you must have worked, and there's two criteria here, which took me a while to get my head wrapped around about why there were the two criteria, but it's at least 3 of the last 6 months, or 10 years without a break of 5 or more years, and at least 500 hours per year during those years. And you're eligible if you need assistance with at least 3 activities of daily living. So the 3 out of 6 years was to capture people like me who may want to retire within the next 5 years or so and would have been able to pay in. So once, those folks who are nearing close to retirement now, if you can hold on for 3 more years, you can get into the trust benefit. Premiums will start to be collected actually in January of 2022. And the first benefits will be available for folks in January of 2025. So we really don't have a whole lot of time to get this thing up and running. So the bill's created a trust commission, and the commission is in the process of being established. We have nearly all of the members appointed to it. We're just waiting for a couple more. And the commission will first meet in April of this year. It will comprise of legislators, the administering agencies and stakeholders. I have a more convincing list on the next page so you can see who's involved. There will be 21 members, and then there will also be a trust council that will be responsible for the annual benefit adjustment. And they will have to meet at least once annually to look at that. There's also an investment strategy subcommittee, and they're responsible for developing the strategy for investing the trust funds. The commission does not have decision-making authority, but it does have an advisory function for agencies and for the legislature. And this slide really gives you a much more in-detailed list of who is going to be part of that trust commission. We have 4 state senators and 4 Washington state representatives, the commissioner of our Employment Security Department, the Department of Social and Health Services Secretary, the Healthcare Authority Director, and the Healthcare Authority in Washington is the main Medicaid agency for our state. We'll have representatives from our area's agencies on aging, the Home Care Association, the unions who represent the long-term care workers that I was talking about, an organization representing retired people, an association representing nursing homes and assisted livings, an association representing adult family homes, 2 individuals who are receiving LTSS services, a worker who is paying the LTSS premium, and an organization of employers whose members collect the premium. So the legislature really wanted to make sure we had good representation of people's voices within the commission. Some of the things that the commission's going to be doing is looking at that criteria for determining who's a qualified individual, the minimum qualifications for our providers, the payment maximums for each service, any rule changes that are necessary to be able to operate the program, and then actions necessary to make sure that the trust remains solvent. There's a whole long list here. I can keep reading if you like, but we can go over that towards the end. One of the things that they're also looking at is whether or not to extend coverage to individuals who became disabled before the age of 18. And one of the things that the trust did not include was benefits to people with developmental disabilities. And that was kind of a sticking point that they want to go back and revisit. And I think part of that is to do with, the risk of covering folks who were disabled at a very young age. So the legislature was really clear that they didn't want to spend a whole lot of money bringing up a whole new infrastructure to support the trust. So the administration of the trust is going to be an interesting governance of 4 different agencies, state agencies. So we have the Employment Security Department, and they're going to be collecting the premium and tracking the status of the vesting. And we just met with our employment security folks, and as I said, they just brought up the Paid Family Medical Leave Act in Washington. They're calling this the Paid Family Medical Leave Act Plus on steroids. So they're thinking about how they're going to use what they've already created to create a similar payment mechanism for the trust. And then we have our state Medicaid agency, and we'll be using our Provider One Medicaid claim system to process the payments to providers through the trust. They'll also track the benefit usage and do the coordination of benefits piece for folks that do have other insurance options. And then we have the Department of Social and Health Services, which is the agency that I work for, and we will be establishing the functional eligibility for the program, so whether they meet the 3 ADLs that are required. We'll be approving the providers, getting the contracts for those providers, and we'll staff the commissions, and customers will provide the customer service, kind of the front end for it. So folks will come through us. What I don't want them to do is to have to go into a local DSHS office and apply for a benefit. This is a benefit that they have paid into. As I said, this is an insurance, and so there needs to be a different mechanism to how to access those benefits than there currently is in place for Medicaid. And we also work with our state actuary, and they will be doing auditing and evaluating the trust to ensure the solvency. Just an aside, all of the admin costs for the trust will come out of the trust benefit, so there's no state dollars going in to pay for the administration of this program. Back on that last slide, one of the things that we heard a lot from legal advocates as we were pulling this together is, if people have got $36,000 sitting in a trust benefit, is that going to affect their eligibility for Medicaid? And so it was very clear this is not an individual account, and it does not affect their eligibility for Medicaid. So I just mentioned that because that was a big concern to our stakeholders as we were developing the Trust Act. So the numbers behind the law. The premium's going to put between $1 and $1.5 billion annually into the trust account. Approximately 15,000 beneficiaries will be served the first year, climbing to over 40,000 in 20 years. And just to give you an idea, our agency currently does around 12 to 15,000 assessments a year. So this is going to double the volume of assessments that our agency will be doing. The benefit payout is quite substantial. It's looking at $5 billion in the first year. And the projected Medicaid savings in the first year is $34 million and $3.9 billion by 2052. And that $34 million is the total cost, so that's both the federal and the state share. So where are we at? In 2019, we started the implementation work. We've been doing a lot of work with our area agencies on aging, starting to think about what that benefit will look like, how it can be structured, how do we make it flexible, how do we make it work with the payment system that we have been told we need to use. In 2020, we're really going to be starting that implementation and then thinking about the policies, the actuarial analysis, and start thinking about whether we have to write rules and what those rules would look like. Really a lot of that, let's get this off the ground and get it going. In 2022, Washingtonians will start paying those premiums. And so it's surprising how many people I talk to and they've never heard of it, or that the fact it's going to come out of their paycheck. So I think part of what we'll be doing is a big outreach and public awareness campaign, so folks are aware and are prepared for when those deductions start coming out of those paychecks in 2022. And then, as I said, in 2025 will be the first year that folks can start drawing out benefits from under the trust. The Commission also has to report to the Legislature in 2021 on these 4 topics, basically the criteria for the beneficiaries and providers. They have to provide the actuarial reports, the recommendations to remain solvent, and recommendations on whether to amend the law to include those individuals with developmental disabilities. And so, like I said, that was one of the things that people really had a lot of concern about with the way that the language was written in the current law. So some of the questions that we get asked are probably questions that are on your mind, and I'm sure you have many more for me, but I'll just go over a couple of them here. And so I'll talk a little bit about how the bill got developed and passed. Like I said, the $36,500 doesn't seem like very much money, but it's a start, and we can look at what difference that will make, at least looking at Washington State's costs. And then what are our next steps towards implementation? What challenges remain for Washington? As I've mentioned quite a few of them, there's quite a few challenges that remain for Washington. And so what are the lessons learned for other states? Because I'm sure you guys will have lots of questions about, well, what if we wanted to do something like that here in Minnesota? What would we be looking at? So it took us 3 years to get this passed. So I'm not going to say this was easy and it was a done deal. But there really was a lot of interest already. There was a broad-based coalition formed to tackle long-term care financing crisis, and I talked about some of the work that had been done and then going to present to the legislature about some of our existing options. We also did education and outreach. We worked a lot. We went and talked to legislators and their staffers, and we went and did forums around the state and talked to a lot of folks to get a lot of input about what they would like and what they would need in a benefit like this. And then the legislature between 2015 and 2016, they mandated a feasibility study. And I think I'll talk a little bit about that, but getting the results from that feasibility study really helped us decide what was the right path to go. In 2017, the legislatures introduced the 2017 Long-Term Care Trust Act. And I think that was really just to get people's attention. It was to get it out there and get people to start thinking about it. Of course, it didn't pass that first year, so we went back to the drawing board, and we worked with our actuarial folks in the analysis, and so we went back again and we tried in 2018. In 2018, we were this close. It got all the way through and then it just timed out. So at the very last minute, there were some concerns raised by AARP, and it was really around the 75-hour training requirement that Washington has for home care workers and what that impact would be on family caregivers who chose to provide care to their loved ones. So what the legislature did was they came back to us and they said, they put a budget proviso in it, and they said, please go away and do some more stakeholdering and do some more studying and come back to us with some further recommendations around that. And then in 2019, It was passed, like I said, last January. It was very exciting. Had got through both committees, hit the national media. We got an updated feasibility study, and then we started developing our interim stakeholder policy work group. So lots of work to get that through. I think what really helped us was we had a huge coalition of advocates that were working with us. You can see folks up on here. We had Leading Age, we had AARP, we had our union for our workforce, the SEIU, Alzheimer's Association, Leading Age, the Elder Care Alliance, whole bunch of folks that really got together, and they created, like I said, they created that budget proviso, and they convened a work group, and they called it Washingtonians for a Responsible Future. And the work group met 10 times, and they did forums around the state, and then they met with legislators. Representative Jenkins, who was the major sponsor of the bill, talked about the moral imperative to prepare for the future and help keep people off of Medicaid. And that was really a key theme in those forums as we went around the state and started talking to folks is, it's not if, it's when. We need to do this, and we need to do this now. We got a lot of voter support. And what was interesting, it was across all age groups. And so we did some work, obviously, with our baby boomers on what they might need. But there was also a lot of work done with millennials, with younger folks, 18 to 34. As you can see, 83% of voters in that age group supported this bill, that it was important, and they could see the importance to them and to their families. They did, AARP did a poll in the last year to gauge support for this kind of program, and then they testified in the hearing and shared this polling information. And I think it was that polling information that was really convincing to our legislature that said, this is something that we can do, and it really kind of gave some authenticity to the premium amount and what would be tolerable by Washingtonians. I love this slide because it really shows that this was a grassroots ground game. The picture on the right, the Vote Yes picture, was cookies that the work group, the coalition, baked, and then they hand-delivered to legislators on the first day of session last year. And so they were up there bombarding them with sugar, which is, I'm sure, why this passed as quickly as it did. But we did have really strong coalition. They did televised town halls with Governor Inslee. They sent out 7,500 emails plus. They put full-page ads in target legislators' districts. They had the hashtag Prepare for Care. And they sent 6,000 petitions were delivered to the legislatures with those cookies. So they were under no misrepresentation that folks were this was not something that they were not interested in. So I love these pictures. That's the Capitol building in Washington State that picture's taken in front of. So that 36,500, we said it didn't seem like very much, but this is just some numbers that we came up with of what that might look like. And so, for us in Washington, that would pay for 25 hours per week of in-home care for a year. Quite a long time. That would fill that year gap. Pays for 5 to 6 months in a nursing home, 9 to 18 months in residential care, such as an adult family home or assisted living, and up to 5 years of family caregiver support that includes respite, caregiver counseling and education, home modification, or adaptive equipment. And I don't know if you're familiar with Washington's benefit, but we do have a current 1115 demonstration waiver. And under that waiver, which was very broad-based waiver, but there were 3 major initiatives, and the second initiative was around long-term services and support. And using those federal dollars, we implemented a family caregiver support program. And so we have 2 benefits. We have tailored supports for older adults, which provides a benefit to family caregivers who have family members who are not yet eligible for Medicaid, so they're spending down for Medicaid. So it was really kind of a first for us in being able to provide federally funded paid services to folks who are not Medicaid eligible. And then we also have a benefit called Medicaid Alternative Care, which provides a similar benefit to folks who choose to have their family caregiver provide services rather than take a state option that they would be eligible for. And so those are two programs that we implemented. This is year 3 of that. And so we just enrolled over our 6,000th person into that program. So it is growing incrementally as we talk. So that's a really great option as well. But family caregiving is such a huge support and so needed. And so these programs really wrap around that family caregiver and help them. So what are some of those lessons learned for other states? I think number 1 is don't be in denial on the need for and the cost of long-term care. We all know it's expensive. And accept that long-term care costs are going to keep pressing on state budgets via Medicaid. You have to realize it's not public or private or family or individual responsibility. It's all of those together. And I think Professor Cohen made that point earlier, that you can't just pick one thing, and you can't just say, is this one thing and it has to fix everything. It's a piece of the puzzle, and we have to keep pushing those pieces of the puzzle together to make the big picture. And then you really have to do a political 101. Think about looking at your starting point. Is your state already leading on long-term care reforms, which Minnesota is? And do you have or can you develop those strong legislative champions and leadership? And I can see we have that in the room today from the questions and the conversations that have already happened. And can you build a broad, strong coalition? Can you bring others in and have them help you and take some of that pressure off? It doesn't have to be the state that's doing this. Have that coalition and get that support wrapped around the benefit. And I think the key one, like everything, it's all about the data. Arm yourself with sound actuarial data. Like I said, when they did that first feasibility study, they had 2 options that they were tasked to look at. And one was the social insurance model paid for by a tax, and the other one was to try and shore up the long-term care insurance in the private market. What the actuarial study showed was this was just too expensive. It was uncertain, there was no guarantee it would work, and it would end up being a high-risk pool because purchasing insurance is voluntary. And it was using that actuarial data that the legislature came to the opinion that we needed to look at the social model paid for by the premiums. For Washington, the hard work is just beginning. We have a short runway to implement, but we're ready. We're going to roll up our sleeves, dig in, and continue to share lessons learned along the way with other states. I hope we'll be coming back here to Minnesota to present to you in another couple of years and let you know where we're at and what's happening and what it took to get there. I really hope you'll invite us back, and thank you so much for inviting me to Minnesota.